www.healthcmi.com. Acupuncture continuing education online today. Acupuncture for diabetes confirmed. This was published July 14, 2019 at healthcmi.com. Let's take a look. Acupuncture aids weight loss and reduces blood sugar levels in type 2 diabetes patients. Sanming County Hospital of Integrated Medicine researchers in Fujian conducted a clinical trial of obese patients newly diagnosed with type 2 diabetes. They conclude that acupuncture treatment, in addition to routine care, is more effective in promoting healthy weight loss and improved blood chemistry than routine care monotherapy. Simply go to healthcmi.com, click on news, and take a look at the article entitled Acupuncture for Diabetes to see all of the details. Now, this also shows you the acupuncture point selections used, including a special extra point. It's one of the Beishu, or what are known as back shu points, called Yi Shu. Now, Yi Shu is not part of the regular system. There are some regular, standard, numerically designated acupuncture points, including Pishu, Ganshu, and Geishu, as well as Shenshu. So those are bladder 23, 20, 18, and 17. These are the back shu points of like the kidneys, the liver, things like this. But there's also Yi Shu. Now, Yi Shu is very special. Also known as Wei Guan Shu, is the back shu point of the pancreas. So it's located 1.5 sun lateral to the midline between the 8th and 9th vertebrae. So this is a very special acupuncture point specifically for the treatment of diabetes, and subsequently has been named the pancreas back shu point. So very interesting point selection here, and really bringing Yi Shu into the light for research. The researchers looked at a lot of blood chemistry here. They looked at blood glucose, glycated hemoglobin, and fasting insulin levels. They also took into account the BMI, the body mass index of every patient, and across all parameters, both groups saw improvements, but they were significantly greater in the group that received acupuncture plus routine care. So everybody received routine care. So for this, they had first-line anti-diabetic drugs, metformin, and lifestyle advice. So this was ways to increase exercise and reduce food intake. So the group that only received this routine care, they did well. But those that received the same routine care plus acupuncture did significantly better. And again, the blood chemistry and the BMI improved more significantly in the acupuncture group. So much that the researchers conclude that acupuncture is an important adjunct care to routine care. All the specific results are right in there. You can go to healthcmi.com, click on news, and look at this article to really get the details. It really breaks it down line by line, chemical serum level by serum level. And what we know here is that acupuncture is a very important addition to diabetic care. This is not just this study, but many other studies. So this is why this is important, and why the article is entitled Acupuncture for Diabetes Confirmed, because this is not a standalone article. It's one of many, many studies. In my personal experience as a licensed acupuncturist, I would say I've seen somewhat remarkable results. Now, these results occur in patients who are compliant. And by compliant, I mean they get their regular acupuncture and or herbs, but they are also working with their nutritionists, their dietitians, their doctors in terms of following a proper medication regimen and modifying food intake. There's not much anyone can do for someone who is just going to hit the donuts, the Coca-Cola, and the cigarettes, right? They need to fall in line with a program. Some of the most interesting research is how acupuncture can protect the eyesight for diabetics. So for type 2 diabetics, it's incredibly important that they fall in line, modify the diet, and move on from unhealthy eating habits. One issue, however, is sometimes people do not know how to conform to healthier eating habits. For example, they may think that eating a lot of carbohydrates, breads, and pasta are somehow health food. In reality, they may need to reduce those things. They don't see it just as refined sugar. But there's a whole package of myths about food that need to be explored with the patient. They may need to include leafy greens and other vegetables in the diet. And yet they may only be getting things that are in microwavable format and not actual fresh produce that's cooked in the home. Also, it might be a lot of restaurant or fast food versions of these things, also containing a lot of sugars, oils, and fats that don't belong there. So a compliant patient who's willing to make those dietary recommendations, when you add the acupuncture and or herbs in there, they get incredible results. Again, what this study shows is that compliant patients absent the acupuncture do not do nearly as well as when they get acupuncture. And were it not for my own personal experience in the clinic for 30 years, I wouldn't necessarily believe it, but I have seen some unbelievable levels of healthy weight loss for diabetics and incredible regulation of the serum blood sugar levels. What's at stake is preserving someone's eyesight. What's at stake is preserving someone's limbs because they may need to be removed in the case of diabetics. So the stakes are very high here. And this article is very important. Go to healthcmi.com. Take a look at the article entitled Acupuncture for Diabetes Confirmed, published July 14, 2019. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com.